Mental health and cultural psychology. Cultural influences. What is a psychological disorder? Psychological disorders are often described as behaviors that are rare and cause some kind of impairment or subjective distress to the individual. Different behaviors can be described as psychological disorders in one culture but not in the other. Specific psychopathologies vary or are similar across cultures. Some conditions appear to be cross-bound and others universal. Culture-bound syndromes. Culture-bound syndromes include disorders which only seem to exist within certain cultures, and they demonstrate how culture can play a role in both causing and defining a behavior. Eating disorders are most identified in Western countries. Bulimia nervosa is characterized by binge eating and induced vomiting. Anorexia nervosa is when the individual refuses to maintain normal body weight, fears of becoming fat, and denies one's low body weight. These two disorders are mostly seen in North America college population, particularly among women. This increase in eating disorders might be because women have been receiving more cultural messages that attractive bodies are very thin ones. We can also identify culture-bound syndromes in South Asian countries. Running amok refers to a condition in which the individual becomes violent, and is associated with homicidal attacks, followed by bonding and ending with amnesia. This is observed in South Asian countries as in Malaysia, Indonesia, Thailand, and it's most common in males than in females. Koro is mostly seen in China and is characterized by a fear that one's penis is shrinking into one's body, and the kind of syndrome could end in death. It is considered a culture-bound syndrome because its symptomology is nearly absent in most cultures. Universal syndromes. Universal syndromes highlight the biological foundation of mental illnesses. Depression is one of the most identified disorders in the West. According to the Anxiety and Depression Association of America, social anxiety affects approximately 50 million of Americans, and it usually happens during teenagers' years. Social anxiety is an intense anxiety of being judged or rejected in a social situation. Suicide is the most tragic consequence of mental illness and may represent the facet of mental illnesses that is most easily compared across cultures because the outcome of the behavior is well defined around the world. If the experience of mental illness can be different across cultures, then we should also expect the same for the treatment of those illnesses. Therapists who work with clients from different cultural backgrounds should strive to achieve cultural competence, and by this they should recognize their own cultural influences, they should develop knowledge about the client's cultural background, and they should intervene in sessions in a way that is culturally sensitive and relevant.